Mention a tick bite, and most Americans are going to think of one disease, and that's Lyme disease. That's understandable. Lyme disease is the most common tick-borne infection in the United States. There are several 100,000 cases that occur every year. But there's a problem with that because when you're so focused on Lyme disease, many people forget ticks can transmit other bacteria, parasites, viruses, trigger allergies, and even in rare cases can cause paralysis without even transmitting any kind of infectious organism. Lyme disease isn't the whole story here. It's probably one of the most important stories, but not the whole story. It's just the most famous chapter when it comes to tick-borne disease. And you have to kind of think of tick-borne disease as a big category, and Lyme disease is one member of it. So when you think about tick-borne diseases, the numbers that the CDC might report, the tens of thousands of cases of tick-borne disease, that's likely an underestimate. I just said that there's hundreds of thousands of cases of Lyme disease, most of which aren't officially diagnosed. Tick ranges have expanded geographically for multiple reasons. Human exposure risks are increasing for multiple reasons. And now there's not really any swath of the United States where tick-borne diseases aren't present. It's not just in areas where you think of as wooded or very forested. And what's happening is tick bites are occurring at such a high frequency. It's estimated that 31 million tick bites occur to humans in the United States every year. And you're seeing that translated into an uptick in ER visits for tick bites. So in 2026, they said that the CDC is saying that the highest number of tick bites requiring emergency department visits occurred. And they've been tracking this since around 2017. So like in April, just to concretize this, out of every 100,000 visits to the emergency department, 105 were for tick bites. And I myself, when I work in the emergency department, I've seen multiple people come in for tick bites, wanting the tick removed, making sure the tick was removed appropriately, maybe wanting a prophylactic antibiotic, which I'll get to in a second. The other point to make is that tick bites occur more frequently in summer, but it's not just summer. Tick bites start to increase in the spring. They sustain they go up in through summer. But if you have a mild winter, ticks can remain active year round, and tick-borne illnesses, most of them can still occur even in the deepest, darkest winters. Another important point to make is people think when they go hiking, when they go camping, when they're deep in the woods, that's when they have to worry about ticks. That's definitely true, but it's not the only time you have to worry about ticks. Think about a suburban backyard. Often it will have trees. It might border a forest. People like to have deer come through their yard. All of that translates into a Lyme disease risk or tick-borne illness risk. Parks that people go to just to hang out, there are going to be ticks there. Even athletic fields, walking your dog, all of those are going to be times when tick exposure could occur. We've seen changes in reforestation. We've seen changes in deer populations, rodent ecology. And remember, rodents are the reservoir for the bacteria that spreads Lyme disease, and rodents also play a role with other tick-borne illnesses. Habitat fragmentation, where increasingly humans are kind of at edge habitats, which are on the edge of forests, edge of places where there may be a lot of ticks present. And then obviously as human development moves into forested areas where you start to do more things, where you're kind of interfacing with a different ecology, that's going to increase your risk of exposure to ticks. And more tick exposure means more tick bites, which means more opportunities for disease. And it's not just Lyme disease, as I've said. What I want to do next is kind of talk about three of the major ticks that spread disease in the United States. It's not all just one. So there's a lot of different ticks. I'm going to focus on three. The first is the black-legged tick, or Ixodes scapularis. This one is associated with Lyme disease, anaplasmosis, babesiosis, Powassan, Borrelia miyamotoi. I'm going to talk about some of these in more detail, but black-legged ticks, one category. Next one is the Lone Star tick, Amblyomma americanum, and it has a sort of little design on its shell. That's why they call it the Lone Star tick. That looks like a lone star. It's associated with ehrlichiosis, alpha-gal syndrome, which is the meat allergy, and something called Heartland virus, which is a more rare infection that can occur. And then the American dog tick, Dermacentor variabilis. This one is associated with Rocky Mountain spotted fever, which can be a very dangerous and deadly tick-borne illness, and tick paralysis, which I alluded to earlier. The point is, different ticks carry different pathogens, and understanding which tick is involved helps determine which diseases should be considered. And you can find the tick, you can put it into an AI, it will tell you what it is, or you can bring it to a hospital and the lab can identify the tick as well. So moving into the black-legged tick, Ixodes scapularis, again, more than Lyme disease, but just a couple points on Lyme disease. Most common tick-borne disease in America. Often it will be noticed because it causes an erythema migrans rash. Erythema migrans is that fancy word for the bullseye rash. Not everybody gets it, but a lot of people do, and that is kind of a telltale sign. Also associated with fever, fatigue, joint symptoms, neurologic manifestations like Bell's palsy, where one part of your face can be paralyzed, or even both sides of your face can be paralyzed. Cardiac manifestations, it affects the electrical system in your heart as well. And there are multiple stages of Lyme disease. The next disease I want to mention is anaplasmosis. And I think it's one of the fastest growing tick-borne infections in the United States. I've seen multiple cases in my home state of Pennsylvania. In 2000, in the United States, around roughly 350 cases were reported. Now it's in, close to 10,000 cases reported. And it presents very much like Lyme disease, doesn't usually have the rash, but one of the telltale signs is people kind of have an unremitting fever. Their blood count will be off. Their white blood cell count might be low. The platelets, which are used for blood clotting, those might be low. Their liver enzymes might be elevated. And this one can be pretty severe. About a third of the patients end up getting hospitalized, and then you diagnose it in the hospital. And I'll talk about empiric treatment and giving antibiotics even before the test comes back. The next one I want to mention is babesiosis. Sometimes this is referred to as American malaria because it's a parasite like malaria, and it infects red blood cells. And it can cause hemolytic anemia, meaning your red blood cells burst. And it can be very dangerous in older people, immunocompromised patients, and people without a spleen. This is something that we had always traditionally associated with places like Martha's Vineyard. There are cases that occur in Pennsylvania. And it can get so severe that sometimes you have to do what are called exchange transfusions, basically transfuse out the blood. And that happened to someone I know. The next one, still working on the black-legged ticks, is Powassan virus. This is a rare but serious viral infection. It causes encephalitis, which is inflammation of the brain. And there's not a specific antiviral treatment for it, and it can leave permanent neurologic deficits. And the thing about Powassan virus is that with Lyme disease and some of the others, it takes a while for the tick to actually transmit the infection. With Powassan, it can transmit within minutes rather than days. So this is one that's very hard to prevent if you get a tick bite. But most people who get it don't have encephalitis. They're kind of asymptomatic, have no symptoms at all. It's only a small proportion of those who contract the virus that actually have the brain manifestation. But the key lesson here with the black-legged tick, Ixodes scapularis, is one tick species transmitting bacteria, parasites, and viruses. So now moving from Ixodes scapularis to the Lone Star tick, Amblyomma americanum. So ehrlichiosis is one disease to remember. This is increasingly being recognized. It's common in the South and Mid-Atlantic United States, but it is expanding northward. Fever, headache, and malaise. That's very non-specific. It could be COVID with that. So this is something that we have to have an index of suspicion, thinking, could this be a tick-borne illness? And ehrlichiosis can become severe if delayed. The Lone Star tick is also in the headlines because it's the one that causes alpha-gal syndrome, which is an allergy to mammalian meat. It causes allergic reactions that can be very severe. They can be anaphylaxis. Sometimes it can be mild, just hives, but can be anaphylaxis. I think the point here is that sometimes a tick bite can cause disease not through infection, but through an immune response. Lone Star ticks can also transmit something called the Heartland virus, which is a rare and emerging infectious disease to watch for. Moving on to the American dog tick, the Dermacentor ticks. Rocky Mountain spotted fever is the one I want to mention. This has an unfortunate name. It was identified in that area, but most cases occur in the Southeast, places like North Carolina. It's very characteristically described as having this rash that everyone notices. There's also problems with the blood count as well. Don't rely on the rash because sometimes that rash might not be present. Someone might be dark complected and the rash might not be visible, and they delay treatment. And I'm going to talk about that in a second, about delaying treatment and what that can do, but that could be deadly. And then lastly, I wanted to mention tick paralysis. So tick paralysis is something completely different than an infection. Certain ticks produce a neurotoxin while feeding, and it can cause progressive weakness, loss of reflexes, and paralysis. It has this really dramatic treatment. You take all of the clothes out, you expose all the skin of the patient, and you find the tick and you remove it, and they miraculously, not really miraculously, but they get better really quickly. So that's a very cool diagnosis to make. And it's really important if you have someone that has paralysis that you're inspecting their body for ticks, including places like their scalp where you might not see one. I mentioned something about delaying treatment and diagnostic testing. You should not delay treatment for certain tick-borne illnesses, and you shouldn't be waiting for the test result to come back. If you have somebody that has a clinically compatible disease, fever, headaches, muscle aches, and pain, they have outdoor exposure, they might have had a tick bite, you don't know if it's Lyme disease, anaplasmosis, ehrlichiosis, or even Rocky Mountain spotted fever. They all have big overlaps. And the test results may take a couple of days to come back. They might be sendouts. So oftentimes physicians, including myself, will start an antibiotic called doxycycline that works against Lyme, anaplasmosis, ehrlichiosis, and Rocky Mountain spotted fever. We just start it and wait for the test to come back because we don't want to wait, especially with things like anaplasmosis and babesiosis. They can be quite severe. So we'll start treatment before the diagnosis is fully established. I think it's important to remember also that not every tick-borne disease responds to doxycycline. I talked about the viruses, obviously, which aren't, and babesiosis is going to require a different regimen. Remember, babesiosis is not a bacteria, it is a parasite. The other thing is that sometimes after a tick bite, if a tick has been attached, if it's the correct tick for a certain period of time, 24 to 72 hours, you can give someone a single dose of doxycycline, and it may blunt the development of Lyme disease or the transmission of Lyme disease. It's kind of up or down whether you want to do that, but that's another thing that sometimes people will do specifically for Lyme disease. So I wanted to mention a little bit more about Lyme disease because it's so familiar that sometimes people use it kind of as a diagnostic catch-all. They think every symptom a person has to do with Lyme disease. But remember, a patient with a fever and a tick bite might have Lyme, anaplasmosis. I went through that whole list. Or they could have something unrelated to ticks. And you can also get co-infections. You can get Lyme disease and anaplasmosis in the same patient. Not every symptom after a tick bite is Lyme disease. Positive Lyme antibody tests may reflect prior exposure. It might not be an acute infection. So you have to interpret laboratory tests in context with Lyme disease. And the diagnosis must fit the clinical picture. It has to make sense that this is related to Lyme disease. And the challenge really isn't simply recognizing that something is Lyme disease. It's recognizing when Lyme isn't the answer. And, when you think about tick-borne disease, there's a lot of interesting things going on that are going to shape how we deal with these issues in the future. A lot of innovation going on. We have a new Lyme vaccine in late-stage clinical development. It's not the best vaccine, but it is definitely better than nothing. People are looking at monoclonal antibodies that you might give somebody at the beginning of tick season, that when the tick bites you, it sucks up that antibody and blocks Lyme transmission. We're getting better diagnostics, improved surveillance system. And I think the key message here is that human beings created the tools that reduced infectious disease risk in the past, and they're now going to be applying that to tick-borne illnesses. That same innovation that we use for all other infectious diseases is going to apply to tick-borne illness as well. Lastly, I just wanted to kind of go through a little bit on prevention. You can get permethrin treatment of your clothing to decrease tick bites. There's tick repellents, daily tick checks. Remember, many of these things aren't going to transmit instantaneously. Powassan is a major exception. You can check your body and remove ticks. Showering after outdoor activities can remove ticks. When you're taking out a tick, just get some tweezers and pull it out as quickly as you can. Don't worry so much about if the tick disintegrates or it breaks apart. That's usually not a major risk when that occurs. When should you seek medical attention? If you have a tick bite and you get a fever, a rash, any neurologic symptoms like facial paralysis, any kind of unexplained illness, I think is worth being seen for. Nature doesn't organize itself around the diseases we know best. You know a lot about Lyme disease, but it might be anaplasmosis. And even though Lyme disease might dominate the conversation, the biological reality is a lot more complicated. Different ticks carry different pathogens. Some transmit bacteria, others transmit viruses, some spread parasites, some trigger paralysis, some cause allergies. And understanding tick-borne illness means understanding the entire ecosystem of the diseases they cause, not just the ones you hear a lot about. But the overarching lesson isn't to be afraid of the outdoors. It's to use technology and knowledge to make it something that you can do safely and to appreciate the remarkable biology of ticks, the risks, the diseases that they carry. So the next time you hear about a tick bite, don't just think Lyme disease. Think bigger, because ticks are much more than Lyme disease.